the steering committee for the Southwest Health Alliance, and I'm joined by Nan Penz-Reuter, who is also on the steering committee for Southwest Health Alliance. Nan, why don't you introduce yourself? And we have a whole hour. This is great, so we can really get into details. And let people know your background and who you are, because I'll say the first thing is that if you have a really detailed healthcare question, it should go to Nan.
To Nan. Oh, thank you very much. And thanks everyone, Chamber and everyone for participating today. We're so excited about this. And you know, when's the last time you ever heard anyone say they're excited about health insurance? Probably never. And I'm speaking from sorry about that. I'm speaking from a career over 30 years. I'm pretty old, but 30 years in the industry, all health insurance related. So I've been on more of the internal side. So think about the pricing, the actuarial, the rate setting, if you will. I've worked with a lot of different companies. I was the director of all the HMOs. There used to be 3 at the Mayo Clinic in Arizona. And my husband and I have been here in Durango for 15 years. We and our 2 doggies, and love the community. And about a year ago, I guess it was July, saw I think it was the Durango Herald and probably the Telegraph, this write-up Monique had done from Local First, saying, hey, we're gonna kind of, get a group together, advisory committee, and tackle high cost of healthcare in our community. So not like I wasn't busy enough, but this was very important to hear this, and I was very excited about participating, so I volunteered. And Monique and I actually learned, we actually went to the same university back in Indiana. It's Notre Dame. You might have heard about it blowing up with COVID with the president. But anyway, we had that commonality. So I volunteered as an individual contributor, totally volunteering. So yeah, it's amazing what you're going to see here. We've got about 20 slides, and it takes us about 30 minutes. So feel free to ask us questions along the way. Monique's going to kick it off, and then I'll kind of come in halfway through.
Awesome. Thanks, Nan. So just to give you a little bit of the history of what the Southwest Health Alliance is, I always like to start at the beginning. And as Jack mentioned, healthcare was not necessarily something that was on certainly my radar personally, or the radar of Local First. We don't have a track history of working in that arena. And at our first ever annual member meeting about 3 years ago, the business community was asking us, what can we do about the rising cost of healthcare? It's just crippling my business. It's making it hard for me to attract employees. And, are you guys going to work on this? And my response was, no, I don't know anything about healthcare. It's so complicated. And of course, that wasn't a good enough answer. And I love a challenge. So we were able to team up with the Durango Network, which are local independent healthcare practitioners here. Unless you are a healthcare practitioner, you may not know what the Durango Network is. I didn't. And so it was this perfect partnership to just kind of get us up and running and do some focus groups with the healthcare practitioners as partners who really understand the system. So that's kind of how we started. And then of course it grew from that, and the recommendations from those focus groups grew into what is now the steering committee. And that is basically a locally led committee of the Local First Foundation. And I'll show you who's on that committee in just a few slides. The output from the focus groups was kind of what you would expect. Healthcare is too expensive in our region. We need to do something about it. One of the recommendations was to look at a healthcare cooperative. So what we're going to be talking about today is really focused on that. But I'd say the healthcare issue that we started to tackle was really much broader than that. And so during this whole process is when we found the Peak Health Alliance. And we are still at home at the Local First Foundation. So here's the fun slide where I get to say we made it to the top. So over the last 2 years, you wonder how much you're really going to be able to move the needle on a particular issue. And healthcare being as complex as it is, and Nan attesting to the fact of being in the industry, can we really do what we're set out to do? And today what we're going to share with you is not only did we accomplish our goals, but we've even exceeded them. So thanks to the Southwest Health Alliance disrupting the healthcare marketplace by bringing the community's voice front and center into that system, we are going to be seeing rates across the board go down by 35% in the four county region of San Juan, Dolores, Montezuma, and La Plata counties, and that's across the board. Now, what we're going to see in addition to that is what Southwest Health Alliance has to offer. Rates are not finalized by Division of Insurance. We expect that to happen in the next week or two, but we feel pretty comfortable with these numbers. But please know that that percentage is on average, right? So depending upon what plan you might choose this year versus what you had last year, depending upon your age and all of that, you know, we're saying about average 35%. And I think when we first started this, we thought, well, 5 or 10% would be great. So we're going to see some real relief, which is very exciting. So to go back to the mission and goals of the Southwest Health Alliance, while we're really focused on explaining to you the product that's in the marketplace starting November 1st for open enrollment, please know that the goals of the Southwest Health Alliance are really much broader than that, and we will continue our work to provide affordable, accessible, high-quality health care to the citizens of the La Plata County region. This started in La Plata County with the business community, but we quickly realized that the healthcare ecosystem here in our neck of the woods is regional. We're so remote. You know, a lot of the community members and individuals from Silverton and San Juan County and Dolores are coming to La Plata County for their healthcare needs. And that what we wanted to do is kind of rising tide raises all boats in the 4 county regions. So that is now our focus. We're looking at increasing health literacy, which someone reminded me the other day that by talking about the plans and what we have to offer with the Southwest Health Alliance, there's already a health literacy increase. So the individual I was talking to from Animas Surgical Hospital said, Monique, there's 6 presentations on healthcare in the next month, right? So we're in that health literacy field by just being able to explain to you what we've done and what we have to offer. But that will be a focus also in the future. Another big focus of ours is providing locally crafted, community-driven plans. And so we're going to tell you more about how the Southwest Health Alliance is that shop local option for our community now. We're going to be exploring value-added options for self-funded in future years, and there are some options we can talk about this year that Nan will mention, and then upholding our community values. So we always go back to the very core reason why we exist and why we formed. And that's because we felt that we needed a local solution that at first we thought could be available to the business community, and then we realized that the solution could be available to basically any individual that lives in 4 counties, which is pretty extraordinary. We want to make sure that we are inclusive of all local providers, that we keep that healthcare ecosystem healthy by supporting local independent healthcare practitioners, and that those practitioners are businesses as well. And that helps to create local self-reliance in our region and minimize leakage of the healthcare system out of our community. Transparency and accountability are huge. You'll see in a few slides how we've been able, through the efforts of Peak Health Alliance, be able to take the healthcare system, keep all the pieces in place, but really have that community voice in the middle of it. And I think it's that transparency and accountability that has given us the results that we're seeing this year. And that is all very data driven. So one of the reasons that we've been able to hold the system accountable is because we work with a data set that's actually available through the state. It's called CIVIC, the Center for Improving Value on Healthcare. And as a nonprofit, we were able to access that data and really see what's happening in the region and where there was room for us to bring those healthcare prices down while maintaining a high quality healthcare system. We're actually not going to get into the data at all today because that would be a whole nother slideshow. But if you have questions, we're happy to answer them. The steering committee is very diverse and really represents our community, everyone from San Juan Basin Public Health to the chamber, who's been a huge supporter. Jack mentioned not only being on the steering committee, but providing financial contributions, which was huge. The rest of these folks are all meeting on a weekly basis. So this has been going on for, 2 to 3, 4 hours a week for the last year and a half. We've also been really conscientious to make sure that we have an open dialogue with the healthcare practitioners. So we have partnered with La Plata County Medical Society, and the Peak Health Alliance has a provider advisory committee that we have Southwest Health Alliance practitioners on and participating in, to make sure that we are in tune with the healthcare practitioners and we understand that system and that that dialogue goes both ways. So the 4 counties that you'll see Southwest Health Alliance in when you go to the marketplace is La Plata, San Juan, Dolores, and Montezuma. Peak Health Alliance started in Summit County. They also are providing plans this year in Lake and Grand. And to clarify what Peak Health Alliance is in relation to Southwest Health Alliance, it's really important because Peak Health Alliance is the purchasing alliance and cooperative. It's enabled by Colorado state statute. It's kind of cool that we have something in the state of Colorado that says, hey, you know, you should be able to form a purchasing alliance around healthcare. And so here's the statute that says you can. It's very similar to, if you think of like a rural agricultural cooperative, you kind of pool that buying power and you bring the community together to try to bring prices down. It hasn't happened very often in Colorado around healthcare. So Peak Health Alliance really took this statute, and with the partnership of Division of Insurance, who needs to approve them as a purchasing cooperative, they were able to get this running in Summit County. That's important because Southwest Health Alliance is not the purchasing alliance. We are the local organizing arm. We are the community down here that's working in partnership with Peak. You're going to see Southwest Health Alliance on everything branded down here. When you see Peak, you know that they are the purchasing cooperative started in Summit County. Peak is not an insurance company. They're not a carrier, so they're not going to bear risk. You're going to hear more about Bright Health. That's the carrier that we've chosen down here. And they use that strong actuarial data analysis to inform really all of the decisions that we make. And similar to the healthcare system and all of the pieces and the parts, we're working with brokers and consultants in the traditional role. We're hoping to keep all those parts of the system in place. We're not trying to disrupt that system in terms of necessarily how it works, but bring the community voice into it. And so this is a diagram to help you kind of understand how we've done that. And not being a healthcare expert, this was very interesting for me to see, like, okay, I feel like I'm a consumer at the end of a very long process that doesn't make a lot of sense to me. It's really confusing. There's people that probably are in positions of power that are making decisions that I have no say in. And so the traditional model is that hospitals are negotiating with carriers, and at the end of the line, you see the consumer who's looking at the products and deciding what's best for them. What Peak Health Alliance has been able to do is put basically that community voice, which is us, the Southwest Health Alliance, in all parts of the system. So everything from the very beginning, right, of looking at that data, talking with the carriers, talking with the hospitals, working with the local independent providers, negotiating on behalf of our community, looking at the plan design. So putting an RFP out is what we did to find out which carrier would best help us meet the needs of Southwest Colorado, and we chose Bright Health. You'll see things that Nan will talk about, like $0 deductible, mental health, copays of $0 to really try to reduce the barrier that we see with health insurance and being able to have access to mental health care and direct primary care, to be able to just go see your doctor without a copay whenever you need. So there's going to be some of those plan design features that Nan will tell you much more about. So my last couple slides here, what we're really pleased to say is that over the last couple of years, we've accomplished quite a few things. So because of Southwest Health Alliance disrupting that marketplace and bringing that community voice in, I mentioned, we're going to see those insurance premiums across all carriers come down by 35% this year. Additionally, we brought a new carrier into the marketplace, and that's Bright Health. So Bright Health has been around in other geographies, but they're here now for the first time. And the fingerprint that you'll see on the Southwest Health Alliance plan is that community's fingerprint. It is the shop local option. We are expecting Southwest Health Alliance to be some of the lowest premiums that you'll see, and Nan will tell you more about that. We're kind of in a unique position because maybe it's because we're so remote and rural, that we were able to brand Southwest Health Alliance really just for us. So if you go up to Summit County or in Grand or Lake counties, you're going to see Peak Health Alliance in the marketplace. Down here, you're going to see Southwest Health Alliance. And we're able to offer ACA-compliant comprehensive benefits, and Nan's going to tell you more about that. We also fought really hard to be inclusive, and so we're pleased to say that Ash and Mercy are both in the network. This was a long, hard conversation of everybody sitting at the table for weeks on end. And our steering committee felt that it was absolutely critical to include both hospitals, and they are both included. Along the way, we upheld our values of transparency, accountability, and local self-reliance. And I would say that it was those values actually that really garnered the interest and support of the community to make sure that we were able to keep healthcare local here. So I'll pause. And I don't know if we're going to do questions or who's monitoring that, but at this point, I would kick it over to Nan.
Okay, thank you. I'll wait on the questions. So this is the, this is a really, really exciting part. So Monique did a good history here of how we got to our end result, or almost end result, right? So when we get approval with the Department of Insurance. So we're going to share with you the some of the highlights, the plan designs. And a lot of these actually were developed after we received feedback from our focus groups, with our local businesses. I'm sure many of you participated in this. And we heard quite a few things other than the cost is too high. So we heard, could we have more of a variety? And by that we mean, what about even a $0 deductible? So from a pricing and actuarial side, the perspective I would bring, I would think, whoa, we can't do that. But it actually is possible, and we did do it, which is even better than thinking that it wouldn't be possible, right? So we have some plans that you'll see when we have the final plans. They have to be done and out on the Colorado Connected Exchange by 11/1. But you're going to see some plans with low deductibles. So this is that first dollar amount that probably you're familiar with. Some of them also are very high deductibles, 5,000, 6,000 deductibles. But we have some with 0. And what that will allow is access to think of more like wellness benefits, which really ties into the second bullet as well. So we did not put any limits on primary care or specialty care visits. And you'll see a variety of flat dollar copays. So again, helping with your budgeting for your family. And then also, as business owners, when you think about what types of products you could offer to your employees. We've got flat dollar costs for MRI, lab, and x-ray, which many times those have been like a co-insurance %, or have to be, you have to meet your deductible, really high deductible, before you can actually, have the benefit of insurance for those. So with this, it actually leads to the transparency comment, where we wanted to actually help everyone to see, hey, maybe you have a choice of an x-ray over an MRI. I mean, probably, maybe not, but if you did, if the MRI is a lot higher, flat dollar cost, you're probably going to go with the x-ray first anyway. And provider of care will probably do that too first. By split deductible option, what we mean there is that we actually have had a trade-off with some drug and the medical deductibles. And again, anyway, it gets into plan designs. So when you will see all of those as well, you'll see some good options, whether you want a % of your drug cost to be paid, or some kind of a flat dollar, if you will, whether through a deductible. Again, all thinking about different ways and different options and flexibility you'll have for budgeting. And then we do have a health savings account plan. That one is going to be offered off Colorado Connect. But I would say with all of these plans, you could go to your local broker, one you're using right now, or we can recommend some brokers if you don't have one, and they can help you through some of these decisions and how to get access. Okay, could you advance, Monique, please? She's got the slide. Okay, this one we thought deserved a slide all on its own, because we had heard a lot of feedback regarding mental health benefits and how there would be a high deductible or even a high copay, and it was really tough to access care. So this was a big focus actually for Peak when they rolled out their product a year ago up in Summit County area. And we also found the same kind of feedback here. So a couple things that we did, and we're really proud of this, we actually helped negotiate contracts so that local mental health providers actually would be paid more than what they usually would be paid. And I can tell you that is, oh, sorry, I'm getting distracted. I can tell you that was very exciting for them to hear, and we were happy to do that. We also were trying to eliminate as many hassles to care, if you will, and part of that is that we wanted copays to be very low and also, same thing, unlimited. And certainly with this year, there's a lot more folks that have, anxiety or even depression and needs to even see mental health providers. So we wanted to make sure that we didn't have any kind of barriers to care for mental health services. So this one is really cool. We're very proud of this. Certainly like any network, not every single doctor will be in it, but we didn't put a limitation on it. We asked, and they could probably still join if they haven't, if you know anyone. Okay.
Yeah.
I think there was a chat down there. Maybe I should answer that.
Nan, you have a really good question.
Yeah.
Yeah. What does it mean for a plan to be off the marketplace?
Yes, thanks for that. Yeah, it kind of popped up. I got a little distracted, but that's a great question. So the marketplace is considered the online exchange or platform. So Colorado Connect. So for those of you that have been accessing individual coverage or individual ACA plans, you actually have gone to that. It's called an exchange. It came about in 2014, that word, but think of it just like an on-place place where you shop for health insurance. And in Colorado, it's called, I'll show you a screenshot here of what it looks like, a little bit of that. So that's deemed on exchange. What that means is any of those products, they actually, folks that enroll with those could qualify for a premium subsidy, which actually brings down the cost of care. You may have heard of this. It actually was part of the 2014 Affordable Care Act plan. And for individuals that actually access care, if the individual and the family makes up to 400% of the federal poverty level, there actually are credits to premium and to the type of benefits. So for example, if there's a high deductible, the high deductible could actually be credited down, and all of that is through government, all that through is for federal government funding. But the way to access that is you have to go to the exchange. However, there's other products that insurance companies want to offer. They don't have to be on the exchange. They're still Affordable Care Act products. They're still fully compliant, but we call that off the exchange. So just think of it as even more options, but you wouldn't get a premium subsidy if you should be in that category. Hopefully that wasn't too geeky. Did that help? I guess if you say no, I don't have anything better. Can Meek advance? Oh, where's our slides?
My internet connection just lost it, so give me a second.
You froze, okay.
Okay.
Coming back.
Do you see it? Oh, am I not sharing my screen?
Not yet. I don't see it yet.
All right, it reconnected, so give me a second.
Yeah, it's coming back. Yeah,
Right.
you got it.
There you go.
Yeah, so this deserves a drum roll, or I guess a pause with the screens. So this is, these numbers are numbers that I got to tell you, I haven't seen premiums this low in probably 7 or 8 years. And I would, I do a lot of work like in different areas of the country, but I will tell you going into this, I never thought that we would have some result for a monthly premium that started with a 2. I didn't even think, I thought we'd be lucky if we had, a mid 3. So the way to read this we need another label across the 4 columns. So you see the first one, it says a 21-year-old lowest cost catastrophic plan for someone who's 21. Those plans are available up to age 30, but we just put one sample together here. All of the rates for these plans are what we call age rated. Gender is not part of that, but it is age. So the lowest cost bronze, silver, second silver, and gold, all of those columns actually represent a 40-year-old non-tobacco user. So that question is allowed to be asked. These are all individual rates. They are all for an individual plan. That is what the product is. But we have a couple really exciting ways that you can use this in your group, in your employer group business. And I have a slide on that and a couple here. So what we wanted to do was just give a snapshot. There's a very important footnote at the bottom there, preliminary rates, just as Monique had said. These are subject to the final approval by the Colorado Division of Insurance. We expect to have final rates, actually all carriers expect to hear from the division with final sign off on rates and benefit plans. I would say by like mid next week, maybe the week after. They absolutely have to be done, and all the rates have to be uploaded to like Colorado Connect to be available on November 1. So you'll be able to see everything then, and you can go and quote unquote shop for benefits then, or even see what these rates look like. And you could get a quote for your own age and for your family. So then we have 3 other rows that are in gray. Those are companies that actually offer coverage in our area today. So like we said, Bright is new to our area. So Bright was in the peak area all through this year, 2000. So we're entering here for 2021. And then there's a company called Friday Health Plan, Anthem, and then also Rocky Mountain. So just to kind of put in perspective there, we have their access to their preliminary rates as they do Bright's. So that's where we pulled this information from. So again, like full transparency, right? Anyone can actually go and dig through and actually see the rates. There's Monique. Yeah, these are just example rates to give you a sense. You'll want to shop on the marketplace. Yes, for sure. And I want to give you a couple other examples here. I'm going to look down at my notes here. So we actually had a couple of real groups, employer groups in town. And I'm going to share with you how you could use these products there, but I'm going to share with you now some of the results. So we looked at a couple groups, and we actually had their census of employees and their current group rates. And what we did is we did a comparison for the ages for each of the employees, and then also their status, like whether they're single, covered, or family, or employee child. We looked at all of that. And to give a couple examples, one group, it's a group of 11 employees. So their current premium is about $10,000 a month. With these plans, equivalent, if not even a little richer, that cost would come down to around $6,000 a month. That's a 41% savings, or over 50 grand a year for that company. If you want to look at it as per employee, that's like a $4,500 savings, per year per employee. Huge. The other group was a group of 5, and these were just random groups, so we have no other data than these. A group of 5, they're currently paying $2,500. It would go to $1,600. So that's a 37% savings. They would save over $11,000 a year. So really important, and as we share all this information, that this is definitely the year coming into 2021 that you want to talk to your broker, or you can talk to one of us regarding how we get to how we can show you similar savings, just to give you a whole nother option from what you have now. We're not against group insurance at all. We actually hope to expand all of this into like true group coverage, but we have a really unique situation in our state, and that is we have lower rates across the board for individual plans versus small group, because there's a thing called a state reinsurance pool. And that's a whole nother complicated thing, but the great news is it brought rates down by about 20% all across Colorado. So that's a wonderful thing that's happening at our state level. That just happened the last 2 years. Okay, you can go on. So how does it work? There's the Connect for Health Colorado. this is just one, like a couple lines snippet of of something like you will see with Connect for Colorado. So when you go to Connect for Colorado's webpage, you put in your zip code and some other preliminary information. And Connect for Colorado, this is the exchange. It will pull up all of the options in your area. So what we wanted to show here is that you're going to see Bright Health, because that's the insurance carrier, the risk bearer, and then you're going to see our logo, Southwest Health Alliance. If you're in a Peak area, up in Summit County, it says Peak on that. So really cool, actually, that we got both logos on there. And then what'll happen is you'll see the premium usually sorted on the left-hand side column. And almost always, I believe, the landing page, as you call it, the first page you go onto, it will list all of the plan designs that are offered in your area. So all the bright ones will pop up in Southwest Health Alliance, and they're going to list them from the lowest premium up. So you can then investigate each one of those, and your broker can absolutely help you if you have any trouble with this. We can help you. I would love to help you, because I really see huge savings that can come to this community. And then you can either reinvest, say, in your businesses, in yourself, in your family. You can make a donation. But you're going to see these rates all stack up from low to high for your age. And the next one. Okay, so for businesses, this is an individual plan. So someone had asked that question. Yes, they're absolutely individual ACA. But there's a really cool regulation, actually. It was called a final rule that got published by Health and Human Services. It was published the end of 2019. It actually came out of the current administration as a way for businesses to actually have more tax benefits of all things. But what it really did too was actually showcase the value of the plans in the ACA and how you might use them in your business. So prior to this final rule, individual coverage health reimbursement arrangements, ICHRA, ugly acronym, it's pronounced ICRA, which is probably even worse. But the ICRAs are the terms of, think of it as a way to pull together individual plan designs such that you could create, it's not a group plan, but you can create access to these plans. And as an employer, this is the new part, as an employer, you actually can set a contribution limit or level. Say if you wanted to contribute $300 a month or less, you can contribute less than that with those rates we saw. $300 a month, that can all be done on a tax exempt basis. So this is, tax exempt, and the employee can actually pay the additional premium, and they get it on a tax basis too. So it's this huge tax advantage for everyone. It's the way that individuals can actually enjoy having some tax advantage, but also the employer can open up, if you will, this option for employees to choose their own individual plan. You don't have to choose one or two just group coverages for everyone. They can choose one of the plans on the exchange, and the premium is paid through the contribution dollars that go into each individual's HRA. And so this can sound pretty confusing, and there's a whole lot more to it, but I'll tell you, it's amazing what can be done with this. So we're not against group insurance at all, but because we have such lower rates in the individual market, this could be a way that you could expand coverage actually, even to some who might be ineligible for your plan. They would still need to be an employee, but maybe you have some part-timers and your current carrier isn't going to allow, eligibility for that person. So you have some seasonal employees. As long as you're going to contribute, and you have to do it on a fair basis, and there's different eligible classes. And anyway, there's more information on this if you want to see where the law actually had come from and all. But better yet, we have brokers. We've been educating brokers locally in town, because we hope to keep we would love to see more brokers locally actually help you with your health insurance, just as we think about all parties, enjoying all the benefits of all this. We know that some of you have brokers in other areas. They may not be as familiar with this. And we do have a list of preferred brokers that are on Peak's Health website. We have a couple that are in this area. And the way they get preferred, they didn't pay any money. They're not getting anything for this other than we want to recognize that they actually went through additional training and certification. And they've had training on how an ICRA platform would work. So it is there are separate companies that would do all the management of the ICRA platform. They're not insurance companies. Most of them are charging about $15 a month per employee for that. But even if you're self-funded, you probably have not seen rates or even claims costs that are this low. So all of the good work that we've done with the negotiation and working with our local providers, they've come to the table. All of that is flown. All of that has basically come together such that we together, can offer something lower.
Yeah, there's a couple of really good questions.
Okay.
Okay, so can businesses use age to classify employees to determine employer contribution amount? I mean, you can classify them any way you want, right? It's up to the employer to classify however they want, I think, right?
They can do that. You can actually, and some are actually paying more toward, employees that are actually charging more. Yeah, you have to set it like as a class. There's a list of 11 different classes of employees that you can set up, like geography and whether part-time, full-time. Actually, I don't think age as a bullet point is on that. But what I've seen done is that there actually are, there's ways that you probably could say, hey, those folks would be into another class. I guess that's the way I would say that. But whoever asked that question, actually, if we can get the name of that person, I can follow up, or we're going to share my information at the end. So can give you that answer with that.
And then there was another question that was really good. Is the ICRA just for the new Southwest Health Plan or any plan on or off the marketplace? That's a good question.
Is it for any? So it's for any plan, and it's not just for Bright either. So this is something that is for every carrier that is offering like an individual coverage. Now, something that is really important with this is that if you are going to contribute to individual coverage, say as a group, and you offer access to the individual plans, that choice of the plan is, your employee's choice. So they go in and choose whatever they want. And I will say this, they don't have to choose Bright. They could choose something else. What they're doing is they're actually using that monies to pay for a premium, directly with that. And then the ICRA platforms, they actually have a connection with you, the employer group, and to the individual. So they have access to actually take out like the monthly premium every month.
Okay, another question was the list of preferred brokers. And because I'm sharing my screen, I can't get you to the exact page, but I will send that around. You can go to the Peak Health Alliance website. And I think the preferred broker list is on their site, not Southwest Health Alliance. So sorry for that confusion. There was another question that could be good for you, Nan. What plan design might work best for a single employee who owns an S Corp? Would one incorporate an HSA for deductibles in combination with 100% tax deduction for full employer contributions? I don't know if I really understand that, so maybe you could address.
So I heard S Corp. Is there already an entity formed? It's already the S Corp?
Sounds like, yeah, yep.
So it already is the S Corp. So I'm sorry, I missed the other part of that. So
what plan design might work? If it's an individual S Corp, they would just they could go onto the marketplace. It's one person, right? Can't see its race.
So there are minimum numbers for each class, and I'd want to get more into that with you, and not or have your broker get into that with you, because there actually are some limitations, like with S Corps. Just throw that out. So if you are an and maybe the question was, you're an individual, so could I get the tax advantage benefit rather than just go straight to the exchange and not have a tax advantage? I think that's probably the question. Hope so. So I would just say it could be possible. I don't know exactly that it's not. The other part I did want to add, though, is that if you have employees that are getting the premium subsidies right now, so say you don't offer coverage as an employer group, and you might know that they are on individual plans, and they're making maybe even 100 or 200% of the federal poverty level. When you make an offer of this and you actually put money into the health reimbursement arrangement, you actually then, how to say this, the person who's getting the subsidies actually is no longer allowed to get them. And the whole idea with that is that now, well, hey, the employer group is quote unquote subsidizing part of that. So it kind of, well, it does, I guess, help everyone so there's no double dipping. But that is an important consideration. However, when we look how low these rates are, it may very well be worth it if you're contributing, say, a couple $100, or I think the average we heard from employer groups was maybe $350 to $400 is where some of them are now. You actually could contribute that same amount, and they could end up getting a richer plan than they would be getting, and they don't need the premium subsidies.
Yeah, great point. There's another question, Nan, that I think shows that there's still some confusion on what the ICRA is. So if you could go over it one more time. The question is, can an employer provide health insurance for some employees and provide ICRA for other employees? Can you help to?
Yeah, the answer to that is yes. So I think it's yes, and there's actually, contingencies. But I think that question is, hey, we have a group health plan. Could we do this too? You can, but what you can't do is have, the offer to the ICRA employees have to be ones that wouldn't be eligible for the group. So where we see this working, and say you keep your group plan in place, but do you not have coverage right now for, say, some that might be out of state or out of the area? You can absolutely set up a class that would be only for, the out of Colorado area. And those are the folks, they only get an ICRA. They are an ICRA choice. They don't get a choice from doing the group plan or not. So there are ways to do it. It's definitely being done, and the platforms that I've talked with, it sounds like it's happening all the time. So it's trying to, bring some solutions together that you wouldn't have to have, for example, an all-extensive PPO. You could actually let your other employees choose something locally. And there may be ways to set up different classes in our current area too.
All right, good questions. Next steps.
Are plans available to anyone regardless of income? Yes. And if your income is lower on the exchange, without ICRA, you actually can get the premium subsidy. But as an employer, if you're going to offer that, they would not be able to get the subsidy.
Ooh, and Nan, can you address helping people that do get a tax credit understand that, I think Claire said something like, as your premium amount goes down, the associated tax credit may go down as well, right? Just to help those that get a tax credit understand what the implications are.
Yeah, so and that actually is just statewide in every state. And so what that refers to is that the federal tax credits are based upon the second lowest cost silver plan design in each state. If it couldn't be more confusing. So if we go back to, the Bright premiums, right? We have that silver plan and second lowest silver. It appears, I'd say 99% sure that Bright's going to have the second lowest cost premium on the exchange. Then the federal government sets the premium credit based upon that number. So what I just referred to, Monique, is that, hey, my subsidy might be down actually if I'm getting a subsidy of $300 from the government, and you don't get this is not in your pocket. It actually goes directly to the insurance company. Maybe that number goes down to $250. However, the rate just went down 37%. So what I'm thinking is when you actually do the math on it, it's probably a better thing. But we also can't change any of that. All of those subsidies are set by the government.
Yeah. Another good question, are there Montezuma County providers who will be accepting Bright? Yes. So any individual in Montezuma County can go and look for this plan in the marketplace. And we have worked with local independent healthcare practitioners in Montezuma County. Right now, the hospital, Southwest Memorial in Montezuma, has not worked with us to be in the network, but at any time, if the community asks them to come and work with us, we are open arms. So I would love for anyone who's in Montezuma County to really encourage the hospital there to work with us. Would be great. We're happy to, like we said, we're inclusive with any practitioner who approaches us. We are 100% inclusive. Another question for you, Nan. Where can I find the information on the employee classes to determine contribution amounts?
Could that person send just their email and I'll send that to you?
Yes, and I know who
I think I saw Zinc quickly, so an accountant.
Yeah, Christy.
Right? Yeah. Okay, yeah, we'll get that down and I'll send that to Christy and help with that.
Here's another really good question from Lori. And Lori, I think I need to get an answer for you, but she wants to know how this works with direct primary care. I believe direct primary care you would have in addition to your insurance. Is that correct, Nan? So, yeah. And I go to
totally separate.
Yeah, it's separate. And I feel like because the insurance premiums went down so much that in a perfect world, for me personally, I would still see Dr. Dan in Whole Health and I would get this insurance, and it would be awesome to have both.
Yeah, I think that's a really good combination. So you might want to even think of, we don't like hearing $7,000 or $8,000 deductibles, but that would be the bronze level plan. I mean, I can tell you that for the most part, insurance companies are making the least off of those because, healthy buy those. But there are now, well, that's not why they make the least, but healthy people are buying those, but then unhealthy are actually buying them. So you might think like, wow, I could never fathom that. Well, they're buying that to get premiums down, right? So what as a fixed cost is going to go out of your pocketbook every month. And then you're buying like a direct primary relationship with that. So think that as you have it for, horrific catastrophic type conditions that can happen to any of us, but then you're actually taking care of all your health, for even, better than even our low copays on some of these plans. So it's kind of, the exchange, of course.
And then how do we get the actual rates for group plans? If you could clarify that, Nan.
So the actual rates for group plans are going to be exactly what you will see on the ACA. And I know that there's going to be lots of questions when you contact your local broker, or if you don't have one. If you have a broker who is out of state, there's actually been several of them that I'll just tell you what I've heard is that they're insuring sometimes a whole package, like maybe all of your P&C benefits, all of your ancillary benefits, all of your health benefits, and they may not be as interested in kind of looking at this because it might disrupt some of that. I mean, just to be frank, not dissing anyone, but just definitely think about that as a business owner, which I'm a business owner. I think about those things too. Our local brokers are just getting educated on this. There is one that is listed as of yesterday on the Peak Health site. I've met with them. It's the J Shore Agency, if you know them. And then the other one, I talked with Ken Bates for almost 2 hours yesterday. So this is all kind of new stuff. They're getting, all educated and actually are very excited about it once they see everything. But we also have connections from a lot of, large groups and certainly smaller groups. Many of you on the call today where you were showing us, hey, yeah, I'm interested in this. So we want to make sure that we can actually, help get, to you. And, this can take time. I'm throwing myself in the ring there. I'm not a broker, but obviously, I will do everything possible so that you get the right information, even meet with you, say with a broker, bring in a broker, so we can actually talk through and actually do some math on this and show you what that could mean. I think that is really a big message with this. If you call someone up and say, what is ICRA? And they're like, I have no idea. That shouldn't happen, but it could, because it is a very new mechanism that really just started in 2020. So certainly, accountants or financial advisors, can help with that. But I'll know enough to be dangerous with this, and I really like the strategic part of this as well, to help think through some of this. And again, I'm doing that as a member of this advisory committee. So we ask you to get with your local broker. Hopefully they'll call us if they have anything. If you don't, get a really warm, reception with that, send us a note, because that just means that we need to go talk with them for the first time or more than we have. You'll see these rates on November 1st. So again, if you wanted to offer this to your employees, it's not a group plan, but it will be exactly the same rate. And then you have to pay $15 for administration. I did include the $15 when I did spoke of those comparisons of how much savings an employer group could have, the two that we did. I included all of those fees in there. Brokers are still paying insurance. Anyway, we see the rates on November 1, so we know there'll be a lot more activity here, November, December, and we have to January 15th to actually sign up. But also as an employer group, say if you have a renewal date past then, you actually can move to a platform outside the open enrollment period. So this is for individuals. So this will not kind of rule, but that's actually a really good thing. It's open throughout the year. We have to give like 60, 90-day notices and stuff like that. But I'm gonna get one of the ICRA platform presentations as well for those of you that want more information, and I can share that. And it's really what I'm going over when I meet with brokers. All righty.
Sounds good. And just a friendly reminder that open enrollment does start November 1st and it goes all the way to January 15th.
Right. And again, just to reiterate, we want to thank everyone behind these companies, the great people of all of these. Many of them have contributed for sure. I mean, Jack mentioned it, Monique did, and we could not do this without everyone, working together. So, it's good that Monique gets, paid a little bit for all of her work. She's been a tremendous leader for all of us. So your dollars are not misused at all. So thank you to all of these. I don't know if you want to say another.
Yeah, I would love to. Somebody asked in the chat if Bright is paying us. So just as a reminder, I am the executive director of Local First Foundation. We are a 501c3 nonprofit. What we did to launch this in our communities, we took about a $50,000, how do I say, liability on for the community so that we could basically make this happen. I still have about 15,000 of that on my books. And so I'm really hoping that when the community sees how much we are going to not only be saving, right, the 4-county region on health insurance premiums, but the shop local piece of it, that I'm going to get a few folks to step up and help. So we are outside of that healthcare system. I will say that starting next year, when you decide to choose potentially Southwest Health Alliance, there is kind of a membership, fee per month that's really small that does go to the Peak Health Alliance. There may be some of that, for example, pays for our time or my time to work on this, but as of this year, there has been, no contributions other than the ones that you've seen on this page, and I would basically be out of a job if it weren't for the Bank of Colorado, the Chamber, LPA, and then all of these towns and counties that dug really deep in a hard year to help us pay to make this happen. So that's kind of my shameless plug, and really hope that folks can step up to the plate. I think, it's hard when you don't know if someone's going to accomplish such a huge goal, and I kind of get that. I think the cities and counties that did contribute were really forward thinking. Now that we've had some pretty great accomplishments, I hope the community will come forward to really help the Local First Foundation. And here's how you get in touch with me and Nan. And again, we'll provide these slides to Jack, so you've got all this information.
And I'm getting paid with smiles mostly.
Yeah.
Thank you. So, but yeah, even if you want to like mask meet, I mean, I'm I mean, I'm enjoying it mostly because it just really feels good. It sounds crazy, stupid, or whatever to say, like giving back or whatever. But for me, it's been a way that, kind of using, stuff that I've learned in my career, been able to do. It really feels like, well, this was a perfect way for me to, to help out. So I want to share this with you. Here's what I want all you to go away with.
And it's so true that healthcare is actually exciting. We have made it exciting and fun to shop local.
Okay. So I guess any other questions? Yeah, just feel free. We've done a couple presentations this week, and I already have like several questions, and I'll do everything that I can to get you hooked up. And I know we have a couple there today. I didn't get those written down, so.
Oh, I'll save the chat.
Jack, you can. Okay. Thank you.
Okay, Jack and Rita, do you have any final words that you want to share?
No, just again, I just want to thank you guys for presenting today and the continued outreach that you are doing and your accessibility. So again, a reminder everybody to reach out to you. I'm sure they'll have more questions, but thank you again for all the hard work that you've done behind the scenes and bringing our healthcare costs down. I know we have the highest healthcare costs in the nation, literally, here in Southwest Colorado. So thank you for that. And with that, we'll wrap up today's session and let you guys get to your next Zoom call.
Thanks so much, Jack, and thanks for your support.
All right, thanks everyone.
Bye.
Take care.
Bye.
Bye.